My name is Dr. Julie Orlowski, and I'm one of the family physicians at our Burgettstown location. I wanted to come to you today to talk to you about the importance of an annual wellness visit with your provider. I'll walk you through each step of the examination, and part of it actually begins before you even arrive here at Cornerstone Care. Throughout my career, I've had a number of times when a patient has come in for their preventive exam and we have found things, sometimes life-saving things. Things like heart murmurs, cardiac arrhythmias, skin cancer, abdominal masses, things that you may not have any symptoms from, but as a physician, we can find that during that examination and possibly save your life. It's all about prevention. An ounce of prevention is worth a pound of cure. The very first step of the preventive examination, as I said before, occurs before you've even walked through the doors of Cornerstone Care. And what this entails is the nurse and the provider that you'll be seeing that day going through your chart, talking about things that you may be due for based on your age and risk factors. So we look through the chart and we say, are you due for a mammogram, colonoscopy, or Cologuard we can offer? Maybe it's been a long time since you've had blood work and we look at your family history and we see that you have a family history of diabetes or high cholesterol or heart disease. This is the time where the nurse and the provider are meeting together and looking at everything that we need to do during that visit on that particular day. Once you arrive and you come back into the examination area, the nurse will get your vital signs. Then, once the provider comes in, we start to talk to you about your history. And this is a very crucial part of the entire preventive exam because it's about reviewing things with you from your past. What surgeries have you had? What medications are you taking? Then we go into family history. And this is really key as a family physician for me to know what types of diseases your ancestors had. So is mom healthy? Is dad healthy? Do they have high blood pressure, various cancers? We go through a whole list of questions regarding your family history. We also will update your social history. And this is just finding out a little bit more about you. What is your diet like? Are you exercising? Do you sleep well? What is your occupation? Drug use, alcohol use, any environmental exposures you've had throughout your life, if you've been in the military or traveled, and that is the part of social history. And so we update that as well. And then any new concerns you might have. So the very first part is once the physician comes in and we're sitting down and talking, going through all of that important history. The next part of the preventive examination is the physical examination. This is when the provider reviews all of your vital signs that were taken earlier in the visit. Then we start our head-to-toe physical examination. We listen to your heart, your lungs. We will examine your sinuses, look in the back of your throat. We can check your joints, seeing if you're starting to get arthritis, do a spine exam. We cover it all during the preventive exam. The ability for the family physician to have the time to sit, update your histories, talk with you, find out how your life has been going, and then to do that head-to-toe physical examination, that is of such great value. After we've completed the examination, then we determine if we need to do any on-site testing that day, as well as place any referrals for you to have testing done at a future date. Those would be things like a mammogram or a colonoscopy. Here at our Burgettstown location, we have an on-site lab and we can give you your immunizations, we can check your cholesterol, diabetes, thyroid, whatever it is that we feel we need to look into that day. If you're having any concerns that day, we actually can test you rapidly for COVID, flu, strep. We can check your urine, making sure you don't have an infection. Many times the labs that we do that day are enough for the whole year. And other times when we find things like high cholesterol or diabetes, at that point, we may want you to come back sooner and do blood work sometimes every 3 months or sometimes every 6 months. The very last part of your preventive examination will be deciding when to come back. Most of my patients come about every 6 months, but if you have very few medical conditions, the one time a year is fine. But for even my patients that I see every 3 months or every 6 months, the one time a year that we can do that annual wellness visit is really key. When I was in medical school, I had a professor tell me that the key to being a great family physician is to prevent the snake bite before you ever have to treat it.